So that's one part of the series of studies that we've done. What we've done there is look also at the other component, in addition to phonetic symbolism, which is smells. Okay, the product scent, right? And we don't look at perfume or something like that, where it's naturally, the smell is a central attribute of the product. But we look at things like lip balm, hand sanitizer, things that are where the smell doesn't really have a big role in why people choose one brand versus the other. And the motivation for that is that car makers and coffee houses have been experimenting with adding scent to cars and to even the lids and on the coffee cups. Things that normally are not, you wouldn't think that that's the main reason why people buy a product. So what we find is that scents are processed in an automatic, non-conscious way. And when the brand name and the product are congruent phonetically, people tend to process information about the product and make a decision, form a preference about the product in a non-conscious way. And that's when the smell of the product influences purchase. Okay? And that's the default way in which we normally go about our lives. We're not constantly thinking, what are the attributes of this product? Should I choose this, or should I go out to that table because it's round and it will hold my coffee? We normally process things in an unconscious manner. Otherwise, we'd be overwhelmed by all the information that's out there. Congruent brand names with the product don't break this flow of how we do things. So then the scent, which is normally processed in an unconscious automatic way, will have an influence on your choice. Okay? So it's all done unconsciously. However, if you break that flow by having an incongruent name, okay, then people will disregard the scent, because then you get people into this conscious mindset about making decisions. So they will discard the scent as a cue to make a decision about the product, because the scent is, again, non-central to these products, right? So they will focus on central attributes, because you break them out of this heuristic mode and you get them into a systematic mode of processing. Okay. I have done research also on the sociolinguistic area, and that again has to deal with communicating, using language as a communication tool, and in the context of other people. A series of studies that we've done, we've looked at a bilingual context. There, we're looking at healthcare. In a healthcare context, at hospitals or doctors' offices, clinics, what you find oftentimes is somebody who speaks Spanish but doesn't speak English very well. And sometimes the doctor, in order to get a full picture of their history and whether they're at risk for a particular disease or not, they will have a translator. And they will have a questionnaire in terms of what are their risk factors to have contracted a disease. What we look at is, with bilingual patients, which language should you use? Should you use, let's say, Spanish or English, if they are able to speak both of them? What we find, interestingly, is that in our context, we were looking at AIDS and AIDS prevention. For a doctor to be able to determine whether a person has a high or low risk of having AIDS, you would ask them about their sexual history. Have they engaged in any sort of risky sexual behavior or not? We did a study in which we asked university students about their sexual history. The theory behind the study is that a phenomenon called language dependency of memory. You may have some memories that are language dependent. For example, if you lived a particular situation in Spanish, you may be able to recall it better later in Spanish when you're telling the story than if you're asked to tell the story in English, and vice versa. What we find is that if a person engaged in risky sexual behaviors with a partner and the main language of that interaction was Spanish, but then you ask them about it in English, they're not able to recall as many instances of those risky sexual behaviors. But when you match the language in which they engage in the behaviors, and when you ask them, so if they engage in risky behaviors with a partner in Spanish, and then you ask them about them later on to remember them in Spanish, they will remember more. Okay, so if there's a language mismatch, they will not remember them as much. When there's a language match, then they will. And that has implications because they will assess their own risk of contracting AIDS to a lesser degree if they don't remember those risky behaviors. If there's a language mismatch, they will not assess their likelihood of contracting AIDS accurately. Yes, because they will not have those memories accessible to them. That's an example of a sociolinguistic study in that you look at language in a social context, right? So with a sexual partner, in the context of a doctor asking you these questions. If you're a doctor, you should ask, first of all, which language are your sexual partners? Which language do you speak to them? And then you should ask the questions about their sexual behavior in that language.